Good afternoon. Welcome to the Alzheimer Society of BC for the teleworkshop, Get Ready for the Provincial Elections. We have two guest speakers from the Alzheimer Society. Just want to introduce today's presenter. We have Rebecca Morris, and she's the Acting Manager for Advocacy and Education at the Alzheimer Society of BC. And how come I can't find the, there we go. We're having problems. I am having problems. There we go. And Alex Chewy. And Alex is the newest member of the Advocacy and Education team. He's the Provincial Coordinator, Advocacy and Public Policy at the Alzheimer Society of BC. And he's the force behind the advocacy efforts with the upcoming election and has been working really hard on that. So you're in capable hands, and hopefully you're armed with a few questions at the end so that they can give you some direction in terms of what you might want to do if you have issues you would like to bring to your politicians or your potential politicians as the election starts gearing up. So I'm going to pass it over to Rebecca, and enjoy the workshop.
Hi, everybody, and welcome to Raise Your Voice, Become a Dementia Advocate. Thank you for making time to join us today to hear a little bit about how you can be an advocate in advance of the next provincial election. So we'll be covering a few things in this presentation. We'll be talking a little bit about what advocacy is. We'll be talking about why advocacy matters and why you should participate in advocacy. And we'll be talking about what tips are available to help you advocate, as well as what resources are there to support you. So we look forward to going through this all with you today. The first question that we get when we're talking about advocacy is really, well, what is advocacy? What does that mean for me? What does that look like? And I always talk about there being kind of two branches of advocacy. There's self-advocacy and there's systemic advocacy. Self-advocacy refers to all of the things that you might do for either yourself or somebody you're caring for. So things like trying to get a diagnosis, for example, is an example of self-advocacy. Trying to get a certain kind of medication, self-advocacy. Trying to make sure that the person you're caring for gets the best care possible in long-term care, another example of self-advocacy. It can also include things like making a formal complaint, for example. But the kind of advocacy that we're going to be talking about today is systemic advocacy. And those two types of advocacy certainly interact with each other, but systemic advocacy are the things that we are doing to change the system writ large. There are things like writing a letter to your MLA, speaking up at a town hall, all of the things that we'll be talking about in today's presentation. I have a little bit of a golden rule when we're trying to decide if something's self-advocacy or if something's systemic advocacy. And the golden rule that I use is, well, if I was able to achieve my ultimate goal here, would this change the status quo for myself or for the person I'm caring for, or would it change the status quo for everybody? So that's kind of the golden rule I use to determine whether or not something is self-advocacy or whether or not something is systemic advocacy. Okay, so why does systemic advocacy matter? Why are we talking about this today? Well, one of the reasons is because we have an upcoming provincial election, and that can be a really good time to get the attention of decision makers, get the attention of the candidates who are running for office in your constituency. So it makes it really a timely time to go ahead and participate in systemic advocacy. The other reason is, well, we have an aging population, and we know that dementia is increasing, and it's going to continue to increase over the coming years. And so this is going to really change the way that we interact with our communities. It's going to change the kind of policy that needs to be in place to support people in BC, because if we are not personally affected by dementia, the chances are we're going to know somebody who is. But many of you will already know that because you have an interest and are on the call today. We're also interested in systemic advocacy because it really gives you an opportunity to have your voice be included in public policy and system change. We don't always have that opportunity just kind of in our day-to-day lives, so by speaking up and getting the attention of the candidates who are running for office in your area, it's really that opportunity to say, hey, these are the issues that are really important to me, and I really hope that you'll go ahead and address these when you're in office. You know, what will that look like for you? So those are a few reasons why systemic advocacy matters. For us as a society, we really see systemic advocacy as mattering because we want to work towards a society that's more dementia-friendly. Our kind of ultimate vision is that one day we have a BC that is more inclusive of people with dementia, where stigma is reduced and people aren't facing those stigmas out there in their communities as people with dementia or as care partners. And one way that we can really work towards that more dementia-friendly society is through advocacy. And we really feel strongly that this isn't something that we can do alone. It's really going to take a movement. It's going to take a lot of people who are wanting to push this forward and are wanting to put their hand up and say, this is an issue that matters to me. And only through those kinds of efforts can we truly affect the change we want to see and create that more dementia-friendly society. So I'll pass it over to Alex.
Thanks, Rebecca, for that great opening overview, and thanks, Jan, for such kind words for introducing me. And I think I'm really quite ready for us to talk about how we can impact with that great introduction and how we can impact at a grassroots kind of level. So today, I'd like to thank everybody on the phone and online with us, and I've been really lucky to work on this advocacy portfolio here at the Society. So before we dive into the bulk of the presentation and some of the tips that we're going to be providing, I would like to remind you that the election is on May 9th, and then we will go from there. So, very first thing, let's switch to the next slide. I'd like to start with just a case study. So let me just read this to you. After 5 years of symptoms, Jane was recently diagnosed with Alzheimer's disease. She's looking to advocate this provincial election for more awareness about early diagnosis. She lives in Saanich South, and she currently does not know who her MLA is. So I think this is a great opportunity to talk about self and systemic advocacy, like Rebecca said, and using Rebecca's golden rule, we can see that for her, Jane already has a diagnosis. So because she has a diagnosis, she technically is advocating for change for other people, and other people in society, other people in her community, and everybody in the province, essentially. So in this case, Lynn and Jane is actually advocating for systemic advocacy and systemic change. Does that make sense to everybody? So I just have a question for everybody. We're actually going to open up the chat box for this, so just for you to join in on this question. But let me just read you this question. With Jane's case in mind, how might Jane's electoral candidate help with her issue? So I would like you to think silently on that. And Rebecca pointed to some of those points earlier, but I'd like you to think quietly to yourself first, and then think about some points that you may want to put in the chat box. And we'll give you about 10 to 15 seconds just to do that, just to answer this question with Jane's case in mind.
All participants have been unmuted.
So I've unmuted the phone lines in case anybody wants to contribute in that way. Okay, so what would some of you do if you were in Jane's shoes? What would you ask your electoral candidate for?
No, I'm using.
Sorry, what was that? I see Maple Ridge Early Support Group typing.
It's no use talking to you. You are. But dishes, it's already all washed.
All participants have been muted, but you may unmute your line by pressing *6.
Okay, so anybody who would like to unmute themselves can unmute themselves by pressing *6. So Maple Ridge Early Support Group says increase home support services, more community awareness, work on reducing stigma. How can you as my electoral candidate help to bring these forward? I think that those are some really great examples. And for those of you who might not have a super concrete example in mind, something that's really easy to start with is we can just say, as my electoral candidate, what is your party's position on supporting people with dementia and care partners? I see Jim typing too. Or maybe not. Okay, we'll move along. Oh. Okay, we'll move along and.
Great. So just to answer the question slightly here, Jane really has 5 options, and to impact with your electoral candidate after, these are the things that she can do to interact with her electoral candidate or her MLA. So she can, looking at these points, do one of the 5 things or more. She can write a letter to her MLA or electoral candidate. She can attend a town hall. She can also meet with her MLA one-on-one or with somebody else. She can write a letter to the editor when a news story is published in the newspaper. And she can also use social media. So these are the 5 things that she can do as a potential advocate and as a BC citizen.
I'm seeing Jim right here, a better educated workforce for home care workers, acute care and residential care aides, LPNs and nurses. Yeah, and some other great examples of the kinds of advocacy issues that people might decide to advocate on. Thanks, Jim.
Right, and just to answer the question with how might Jane's electoral candidate help with these issues, such as LPNs and nurses, educated work staff, your electoral candidate can then take those issues and be your voice, and then raise your voice in the House, with your minister, with the minister, and go from there as well.
Yeah, I think that Alex brings up a really great point, that once this candidate is elected, they're really going to be your voice in the BC legislature. So it is incredibly important that you give them opportunities to really hear from you about the kinds of things that are important to you and the kinds of things that you would like to see addressed if that person is elected.
Great. So with our campaign this year,
Rebecca?
Hi there.
Oh, hi there. Listen, I'm wondering, I'm sorry to interject. My phone just unmuted. Thank you so much for that example of that case study. I think I found that to be very interesting on a number of fronts. But most importantly, my question toward that, just prior to Alex beginning on his next verse, was, do we have an understanding of where the particular MLA is at with the government currently, and how would we go to fill those gaps that perhaps are outstanding with the Alzheimer's Society? Now, kind of segueing off the case study itself, just for a moment, is that naturally when we look at the systemic advocacy ask, my feeling is that what you have there is naturally a combination of a number of avenues in which the individual is requiring assistance. So my thinking on this is, in terms of the best thrust of support toward the MLA, is to understand where we're at with those particular items. Does that make sense?
I think so. So if I understand you correctly, you're really saying, how do I know how my MLA, or in this case, your electoral candidate, what their position is about dementia? And I think that the best thing we can kind of ask them is, well, what's your party's position on dementia? If you're elected, how do you plan to represent people with dementia and care partners, and what changes would you like to see made? And then taking that and following up on it again once that person's elected. So we are going to talk a little bit about a few tips that might be helpful in a moment. So hopefully that kind of partially answers your question, and we can talk about some more pragmatic tips for doing so in a second here.
Thank you.
Thanks.
Great. So thanks for that question. So we're actually just going to dive into the tips now and talk about what we're going to be working on and the tips going forward. So our tagline this year is show your courage, raise your voice for dementia. And leading up to the election, we're really trying to empower Jane in this case, and other people on the line and everybody else in the community with the appropriate tools to really raise their voice. So we look to provide tools to write a letter to your MLA, to connect with your MLA, and talk along those points that were asked in the question, actually. So we're really looking to give you the tangible skills and tools to raise your voice and show the courage that everybody has to step into the community and speak up for dementia. Great. Great, so in this next section, like I said, we're just going to go over some of the tips. Most of these tips come from our advocacy guide, which is on our website, and we'll talk about some other tips that we've also created to be read alongside this guide, which is the more detailed, but we've made single-sided, double-sided, election-specific sheets specifically for the election and advocacy in that regard.
Great. So I think one of the first things that we can do to inform ourselves as an advocate is we can figure out who our electoral candidates are in our area. So if it's not an election time, the first thing we can do is go to the MLA Finder, and it's a really straightforward tool. You can plug in your postal code and kind of up comes your MLA. But because this is an election year, because we're leading up to an election, there'll be many people who are running for that spot in legislature. So you can find out who is running in your area by going to Elections BC. The other thing you can do is you can contact Alex here at the Alzheimer Society, and he can help you find out that information. So there's a few ways that you can find out who is running to represent you in your area. We also have some tips on writing a letter, and I think that some of you who are listening today may have experience writing a letter to your MLA. What we really let people know is that while a lot of people think, well, my one letter won't matter in the eyes of a busy politician, this actually isn't quite accurate, and in fact, elected officials really rely on the correspondence they receive as an indicator of how people are feeling out there in their communities. So if somebody gets one letter, that's going to indicate that a lot more than just that one individual care about that issue. And so we have a few tips for really getting your point across. We suggest that succinct but personal is best, so if at all possible, you want to keep your letter to 1-2 pages at the very maximum. You want to see your MLA, or in this case, your electoral candidate, as an ally rather than an opponent. So we always want to be as respectful as possible and to approach that person with respect and as a partner in working towards that dementia-friendly society that we all want to see. You might choose to follow up on your letter in a month, or in this case, once the person has been elected, if they are successful in becoming elected. You might choose to use statistics from the society website, and you can connect with Alex if you want more information about that. You might choose to ask for a meeting. Sometimes having that face-to-face interaction can be a great way to tell your story. And you want to ask them for their position. So you want to ask something concrete of them. So what is your position on this issue, for example? If we're advocating in the time after the election, you might say, you know, can you bring this up at the legislature, or can you connect with your colleagues to see what their action plan is for this, etc. Okay, so again, one letter a politician receives really indicates that a large group of constituents are concerned about the same issue. And so it goes to follow that if you can encourage other people in your life to also write a letter, that's really going to help spread the impact. We really encourage people to keep their stories as personal as possible. Sometimes people will come to us and they'll say, well, why doesn't the society just develop a petition and then everybody can sign that petition? Well, we know that those kinds of petitions aren't always as effective as when people really do take the time and effort to share their personal experience. And hopefully this guide and these tip sheets make it a little bit easier to do that, as well as Alex's support if this is something that you're planning to do. So we're going to go through a few sample letters, one that needs a little bit of improvement and one that might be an example of a powerful letter.
All right, so this is the first sample letter. It reads, "Hi, Steve. Why can't you people get the healthcare system right? I was in the emergency with my husband for 5 hours last week, and some stupid nurse didn't understand anything about dementia. The whole situation is unfair. He is a veteran after all. We need change, and we need it soon. Is the government doing anything to fix these problems? Thanks. Sandra McDonald."
Okay, so in some cases, this might be truly how we feel in our heart of hearts. It might be a really frustrating situation. We might be tired out because we've been doing a lot of caregiving, and this really might be how we feel. But it's probably not going to be the most effective way to get our point across. And there are a few things that I'll point out here. When we're addressing a letter to a candidate or to an MLA, we want to use the appropriate salutation. So we would say, "Dear Mr. So-and-so," or "Dear Miss So-and-so," just to really indicate that we do have a respect of their position. If this is a minister, we want to be referring to them as Minister Honorable. And again, you know, that's something that Alex can help you with, and there are a bit of information about that in the guide and in the toolkit. Why can't you people get the healthcare system right? You know, it's a question, and we always do suggest leading with a question. But it's probably not the kind of question that a decision maker is going to see, or a potential decision maker is going to see and really feel like it resonates with them. So you might ask something a little bit more specific, like what are you doing to address wait times as they relate to people with dementia, for example. It's great that a personal example is used here, but you know, again, thinking about that respectful language and really using that throughout the letter. And then, you know, the last kind of question that the person leads on is the government doing anything to fix these problems? And that's probably not specific enough for, you know, a candidate to come back and say, well, you know, here's the position on this. So there's just a few things, and then finally the salutation. So thank Sandra McDougall, you know, probably want to sign off with saying something like yours truly or sincerely. Again, just something that indicates a little bit more respect for the person's position. The other thing that we really suggest, I got a little bit of that cold over here. Another thing that we really suggest is making sure that the person has your contact information so that they can respond to you, because if they don't have your contact information, they won't be able to get back to you and answer your questions. So those are just a few things. So let's go on to the letter that might be a little bit more effective.
All right, so hi, Mr. Partridge. I'm writing to ask you if you support increased access to adult day programs for people with dementia in our local area. Caring for a person with dementia is challenging, and appropriate, timely access to these programs can help caregivers like me cope. Few spaces and long wait times have been a reoccurring theme for people in my support group. I would like to meet with you to talk about this more at your earliest convenience. Yours truly, Sandra McDougall, and a phone number.
Okay, so there's some things that I would point out here that really indicate that this might be a more successful letter. First, there's the appropriate salutation. You know, you start by saying, hi, Minister Partridge, who isn't a real minister, by the way. She's putting her ask right in the first paragraph, and that ask is, I'm writing to ask you if you support increased access to adult day programs for people with dementia in our local area. So a really clear, concise ask. But then she also shares her own personal story in a compelling but in a respectful way. So I think that might be something that really helps the person who's receiving that letter identify with the person who's reaching out. Something to remember is that a lot of the candidates who are running for office are going to have some kind of personal experience with dementia, whether that is a spouse, whether that is a parent, whether that is a grandparent, or whether they're a little bit concerned about their own memory. They are certainly going to have some connection to this disease in most cases. And you see that Sandra is saying, I would like to meet with you and talk about this more at your earliest convenience. So there's a next step there. Sandra is working on fostering this relationship with this individual and really setting some next steps in place. Okay, so those are just some tips for writing a letter. There's some more tips for connecting with your MLAs, especially as we lead up to an election. You can sign up for their paper-based newsletter updates. And these paper-based newsletter updates will often let you know when a town hall is going to be happening in your area. So we'll talk a little bit about town halls in a second, so that can definitely be helpful. If you're a social media user, you can also stay connected to their Facebook or Twitter pages. Certainly not everybody is, but that can be a really good way to get timely information if you are on Facebook or use Twitter. You can set up a meeting with your MLA or the electoral candidates in your region. You can consider going with another person who's informed about the issue. Sometimes going with somebody else can really make it feel a little bit easier to do that. You can bring facts about dementia from the Society's website. And you can send a thank you note and let them know that you'll be following up in 6 months. So it holds them accountable. In the case of a candidate, you might say, you know, I look forward to connecting about this if you're successful in your efforts to be elected to legislature, for example.
Right. I would just like to add just a very quick thing. I think these three points are kind of also in a structure where it starts as kind of the easy entry for signing up with a paper-based newsletter. So if you are trying to encourage others to stay connected with their MLA, you can start with the first one and ask them to just sign up and stay connected. And then the next step would be Facebook potentially and Twitter to connect with them, and then ultimately the goal would be to meet with them and kind of have that face-to-face. So it's kind of in that step 1, 2, and 3, and kind of increasing in difficulty and time.
Yeah, a little bit of a menu, so to speak. And again, you know, I've said it before, I'll probably say it again before the workshop is over. Every action really matters, whether we're doing something small or whether we're doing something big. These all add up, and they're all ways of showing your courage and building a society that's more dementia-friendly. So something that some of you might do, and I know that some of you on the call today on the webinar have experience with doing this, some of you might decide to write a letter to the editor. And there's a few tips for doing this. The most effective time to write a letter to the editor is when a story has been written about dementia in the news. So we probably don't want to just sit down and write a letter anytime. We want to wait until there's been something about seniors, something about dementia, something about long-term care that can help us bridge into the issue. And what I do when I write a letter to the editor is I use the first few sentences to quickly note the topic of the news story. So for example, I really enjoyed the story on early diagnosis and why that was important to so-and-so. This was helpful because, and then you bridge into your own story, saying something like, dementia is a really important issue to me because my mom was recently diagnosed, and I really think that here are some important points that need to be addressed. So using the story to find an opportunity to springboard into the issue that's important to you. So, and of course, if you can add a personal connection to the story, that's always immensely helpful because people remember stories. When we can think about the times that we've been impacted or influenced, for most of us, that's when somebody is using a really compelling story. And so it's a good reminder that your story as somebody who's been diagnosed with dementia or as a care partner is probably pretty compelling to a decision maker. So that's one tool in your toolkit. Okay.
All right. So I'd just like to go over attending a town hall. So this is a town hall, just as a definition, is any type of gathering, whether it be municipal, provincial, or national for politicians. And it can be for community members, and it's completely open to the public. And like it says here, it's definitely a great opportunity to raise awareness in your local community and to ask questions. And usually in these town halls, you'll have most, or if not all, the electoral candidates in the area. And so you essentially have them have their ear for that short period. I'd like to actually read a question that an advocate actually asked at a town hall, and I think it's quite powerful. So it has a little bit of aspects of what Rebecca said, where you share your personal connection, and then with a question at the end. So I'm just going to read this one, quote, "My mother has Alzheimer's disease. She was firm about staying at home for as long as possible after she was diagnosed. What is your party's plan to help older adults, like my mother, stay at home for as long as possible without compromising care?" So it's that little bit of asking a question, having a compelling story, and keeping it concise.
Yeah. We don't want to go on for 10 minutes because that can be frustrating for the people who are listening in the audience as well as the person who's answering the question. So I think concise is really key.
Exactly. And sometimes if you can actually shorten it into 120 characters or on a Facebook post, you can also attach that as well. Here's an example of one that is quite short but gets to the point. Quote, "Dementia is one of the few diseases that require 24-hour care and monitoring. This can lead to severe caregiver burnout. What is your party's plan to support caregivers?" So just a very short, concise way of asking a question that can be asked on social media, can be asked at a town hall in front of an audience, which also gets the dementia-related issue out into the public and also to the electoral candidate. So to actually, just to the last point on the town hall, to find out when your next town hall is, we suggest following your electoral candidate, any one of them or all of them, and they will definitely let you know when their upcoming town hall is because they want you to come and join them in meeting the community.
Whether that's by email, whether that's by their paper newsletters, or whether that's on Twitter or Facebook.
Exactly. All right, so we've talked a lot about the actual tips itself that are from the advocacy guide and here and there from the tip sheets. Jan was very helpful in actually uploading the resources actually that were listed on the slide on the right-hand side of your screen. So there are 3 tip sheets.
Brand new tip sheets.
Exactly. So I'll hold them up for you. Just I'm pretty sure you won't be able to see on the computer, but these are brand new sheets that you have access to now because Jan has uploaded them, and we also have them on our website. So the website is live, and you can access these 3 tip sheets as well as the advocacy guide from the website. So if you want to redirect others to these tip sheets, that would be definitely a great step. And here's the advocacy guide that is in the picture as well as hard copy as well. One last thing is that to lead you in anticipation, we would say, is that we have short videos planned to be released later this week and early next week, and then we plan to have those exciting videos up and ready for everybody else to share.
Do you want to talk a little bit about what those videos cover?
Sure. So the videos are actually some of our advocates that have been inspirational to me, has been inspirational to others in the community, and we've had the opportunity to almost do a quick interview with them, and they're less than 1 minute and very easily shareable. So we were hoping to spread that message, spread their inspiration to others in their community and to others across the province, and to really help people show their courage and show their courage to actually raise their voice because somebody else is doing it, and they can be this inspirational, so can you. And we all have compelling stories. We all have stories related to dementia. It's just how we can frame it and inspire others to do the same. So this is just a slide just to remind us that if we were to sum up what I just said, it's let's create a movement. So let's come together, let's inspire others. We have physical copies, we have ways to share knowledge, we have this teleworkshop that can be spread across the province as well. So we have different things and mediums that we can actually create a movement with, whether that is sharing a physical copy of this tip sheet with your neighbor or with your friends and family. We have all those mediums for that to actually create a movement for dementia. I'm quite excited for this next month coming forward.
So why don't we open it up to any questions that folks might have?
Just before you do, I am just going to, for the benefit of those who aren't going to stick around for questions, there's the sharing the resources. I just want to very quickly give you a little flavor of what the Alzheimer's Society has, if this is your first teleworkshop, and then I will pass it over to Rebecca and Alex again. For those of you that are not aware, the Alzheimer's Society has several resource centers around the province that offer information, education, support, referrals. There's our First Link Dementia Helpline, which is available Monday to Friday, 9 to 4, and takes messages on off hours. If you are in the Lower Mainland, the number is 604-681-8651. Outside of the Lower Mainland, it's 1-800-936-6033. We have Minds in Motion programs around the province. That's a fitness activity program for people with early symptoms and a care partner. There are support groups for people with early symptoms as well as support groups for care partners. We have lots of education going on, getting to know dementia, shaping the journey, family caregiver, or more teleworkshops. So there's a lot of things going on in terms of education. The information bulletins, I just realized we didn't update. We have First Link bulletins as well as a new bulletin called Connections, which is for caregivers and others, and Insight for people with dementia. And our website is always a really good source of information, credible information. Here we are with the little thumbnail of the Connections newsletter that is brand new. And you can subscribe to these through our website. You can actually see them on the website if that would be your preference. And here's just some phone numbers. Alex mentioned the handouts. There is the advocacy guide, the 3 tip sheets, as well as the slide deck are on the handouts. If you can have a look at those yourself on the computer, great. If you don't have access to a computer or you would like to print them up and you don't have access to a printer, by all means do connect with us at the provincial office and we will get you a copy. So locally it is 604-681-6530. Outside of the Lower Mainland, 1-800-667-3742. And with that, I am going to pass it back to Rebecca and Alex, and hopefully you have questions. If you would like to ask a question through the chat box, great, and we'll read it out for everybody. If you would prefer to ask it over the phone, press *6, and that will unmute you. Back to you two.
Or anything to add or any tips you might have for the other folks who are listening today. See Jim typing there, so. Yeah, I'm wondering, okay, so Jim's question is, I'm wondering if you have produced a one-pager that people can give to their candidates. I'm thinking of one for various general issues or one on the society. So just, Jim, are you thinking just kind of like a brief on the society? Yes. That's not something that we've developed to date, but we can certainly look into what kinds of resources might be helpful. You know, in the meantime, you know, Jim, I know that you're very knowledgeable about the society, but for folks who might not be as well oriented, you can certainly connect with Alex and have a conversation about what kind of information might be helpful to share. So that might be the place to start, and we can look into that one-pager. Thanks, Jim.
I would just be interested if anybody on the call has done some of this in the past. Have you talked to your MLA, and how did it go for you?
Great question, Jan.
Were you asking the question just pertaining to dementia or Alzheimer's, or just in general for experience?
Gosh, I think we can say
either.
Yeah.
Sure.
I have spoken with several MLAs in the past and found them to really run the scale. If that answers your question, I think in terms of context, if you'd like more or a deeper, or not explanation, but a deeper comment, I'd be more than happy to wrap an answer around a question you might have about maybe what my experience may have been.
So run the scale, basically you mean some were incredibly receptive all the way to really not so much?
Exactly.
Okay.
Exactly. And I mean that with absolute respect. We know these people are very busy.
Yep.
And I suppose it's as well on the approach, the subject matter, their comfort level with what the subject matter is or was, as well as current situations potentially within their party, as well as within the community about what that particular subject matter may have been. So it too is kind of a loaded question, but certainly I would concur that with your session today in terms of your tips and also the excellent guides that you provide for individuals in the community are exceptionally done, over and above commenting about the provincial guide to dementia care, as well as, you know, the future plan, the future action plan, I found to be incredibly informative. And so if I could just also comment about the one-pager, I think that Jim had mentioned, I think that's fantastic for an individual like myself to be able to harness percentages, numbers, and real concrete information about where situations currently are, and look to my ask specifically for future results. Thanks.
Thanks so much for sharing that. So I'm seeing Jim here. So I had a candidate I challenged the other day. As he left, he said, "You've given me homework," which I was pleased about. Or which I was pleased to hear. At least I can think he will investigate some of the issues discussed on the doorstep. And Jem, I think that you remind me that we haven't discussed the very important issue of, well, what happens if a candidate comes to my door and they're campaigning? And what a great opportunity to say, well, you know, dementia is really something that's important to me. What's your party's position on this? What do you think about dementia? What are your plans if you're elected? What are your plans to really bring dementia to the forefront as a really important health issue? And I think that that's a great example of using that opportunity to really interact with that candidate and encourage them to really think carefully about how dementia is impacting their community members. So it's a great example. Thank you, Jim.
Yeah, I'd just like to add a point, and I think that's, if we do, and if they don't have an answer for you at that moment, and they do go and look to ask their actual party, that's actually, I think, a good advocacy tool for them and for us, because that is raising, a community member asked me a question about dementia. Do we have plans moving forward for the whole party, right, to actually address these issues? And I've heard this question a couple of times. I don't know how to answer it, right? And taking that to a higher level. So thanks, Jim.
Keeps the conversation going, and it gives people opportunities to really continue that conversation beyond that one interaction that you're having. Yeah, that's a great point, Alex. Yeah, I mean, and we talk a lot about, well, we're starting a movement, we're engaging in a movement, we're pushing a movement forward, and I think something that's really critical to remember is that decision makers and politicians and all of those folks, they're really part of that movement too, and it's going to take not only our advocacy efforts, but also the really critical insights and perspectives and willingness of those folks to really build towards that more dementia-friendly society that we talk about. Alex, do you want to let people, to let you know what candidates they have spoken to and or all candidate meetings?
I think I would be great to engage in, very happy to engage in those conversations. So my email is on the website. It's just advocacy at alzheimerbc.org, and then you can just connect with me that way. It'd be great to hear your stories and your experiences and your reflections on how a town hall went or an interaction went, and we can discuss and take you on that, and you can take me along on your advocacy journey. Thanks, Jim, for asking that for everybody.
Any other questions or reflections, suggestions for others?
Just want to add here, Alex is based out of provincial office, so you can call him at the provincial office number as well, 604-681-6530 or 1-800-667-3742. So if email isn't your preferred way of communicating, he's available by phone, fortunately.
Thanks, Jen.
Keep him busy.
Yeah, that's it.
Jim, I encourage everyone to participate in the electoral process. It is worth it. Gosh, Jim, I couldn't agree more.
Well said.
I think that might be a good note for us to kind of leave you on today. If nobody else has thoughts or questions for us, as we've mentioned throughout the presentation, please do connect with us, and we are very interested to hear how your advocacy journey goes. And thanks for being alongside us as we embark on